Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 5th, 2025. This video is on blood pressure reduction and all-cause dementia in people with uncontrolled hypertension, published in Nature Medicine, published online 21st April 2025. There was an accompanying News and Views article which was published online on May 2nd, 2025. Dementia is a global health crisis with rising prevalence, particularly in lower and middle income countries. Hypertension is a modifiable risk factor, but evidence linking blood pressure control with dementia prevention remains limited. The China Rural Hypertension Control Project, number 3, tested if blood pressure lowering reduces all-cause dementia in rural Chinese adults with uncontrolled hypertension. Study design, open label, blinded endpoint, cluster, randomized control trial across 326 villages. 33,995 adults participated above the age of 40 with uncontrolled hypertension. Intervention, non-physician led step care blood pressure control, aiming for less than 130/80. The control were usual care without protocol-based blood pressure management. The primary outcomes were all-cause dementia over 48 months, adjudicated by an independent panel. What did they find? The mean blood pressure reduction in the intervention group was 22/9 millimeters of mercury. Dementia risk reduced by double digits, 15%, with a p-value 0.0035. Cognitive impairment, no dementia, sin risk by also double digits, 16%, and the composite of dementia or death was also double digit, less than 14%. Serious adverse events, less than 6% versus usual care, p-value 0.0006. The key takeaway, intensive blood pressure lowering via non-physician and community healthcare providers significantly reduces dementia risk. They had an effective scalable model for dementia prevention in the lower and middle income countries, reinforces blood control as a cornerstone for healthy brain aging. The accompanying commentary frames this trial as pivotal in linking blood pressure control to reducing dementia, highlights scalability via non-physician care models in lower and middle income countries, emphasizes policy impact and cost effectiveness. Key points: 15% reduction in dementia risk adds to prior reductions in myocardial infarction, stroke, heart failure, cardiovascular disease, death. Greater blood pressure reduction than other trials, example SPRINT and SPRINT Mind. Stronger effects in those less than the age of 69 years. Attenuated but favorable in those above the age of 70. Limitations: end-only dementia assessment, unblinded participants, no baseline cognitive scores. Key takeaway: blood pressure controls protects the brain. A call to scale up global implementation. Podcast brought to you by Master MedFacts at mastermedfacts.com.